and I'm one of the clinical recruiters here at City of Hope. Thank you for joining us today for our tweet chat for Nurses for Hope discussion and panel discussion. Today's topic will be, what does it mean to be a nurse at City of Hope? City of Hope is a research and treatment center for cancer, diabetes, and other life-threatening diseases, and we're located in Southern California, right outside of Pasadena. We're a designated comprehensive cancer center, and we're one of the founding members of the National Comprehensive Cancer Network. We have a few of our values and our mission statement that would like Leilani Patatzel to go ahead and tell us about City of Hope.
So City of Hope's mission is transforming the future of health. Every day we turn science into practical benefit. We turn hope into reality. We accomplish this through exquisite care, innovative research, and vital education focused on eliminating cancer and diabetes. We do have values that I'd like to mention, and the first one is compassion. Second one is service with a sense of urgency. Third, integrity. Fourth, intellectual curiosity, excellence, and collaboration.
Thank you, Leilani. I'd like to introduce you to our panelists for this afternoon. We have Monica Munaretto, and we have Micheles Johan.
Hello.
And Catherine Torres-Nicholas.
Hello.
And what we'll have each of them do is we'll start out with having them introduce themselves and talk about their career path here at City of Hope. And if you're watching us on Google+, you can submit your questions through the Q&A application that you see there. And if you're viewing the broadcast on YouTube, the annotations are available on the video. The annotations will point you to the Hangout on Air page and the Q&A application. And then if you're joining us on Twitter, just make sure that you're adding hashtag Nurses for Hope to your YouTube. Okay, so we'll go ahead and get started. And you can always check out our career opportunities at www.cityofhope.org/careers. And so we'll go ahead and get started, and we'll start with Monica first. And Monica will describe her career path here at City of Hope and what it means to her to be a nurse here and how she became successful at City of Hope.
Well, hi, everybody. Thanks for joining us on this tweet chat. I started my journey at City of Hope as a traveler, and I had been traveling at other transplant institutes across the U.S. My recruiter told me that there was this little place in Southern California. I jumped at it, and I haven't looked back. There's something very special about City of Hope, and it embraces you, and it takes you in, and it helps support you and guide you through several different areas. And after I stayed here for a while as a traveler, I signed on as a nurse, worked nights and days, and I went down the educator track and was an educator for the transplant unit for several years, and I'm currently the manager of the transplant unit. So City of Hope has changed my life, and it's where my family is and where my family from the Midwest comes visit. And City of Hope is just a part of all of our lives. So it's really benefited us.
Thank you. Thank you very much, Monica. Michelle, how about you?
My name is Micheles Johan, and I started at the City of Hope about 18 years ago. And I was a nursing student, and one of my coworkers, actually one of the other nursing students, had told me about the City of Hope. And I came to visit, and I was in the staffing office, and just to see the collaboration of the nurses, the longevity of the nurses, I'd asked, what was the turnover rate? And it was, nurses were here at a minimum of 30 years. And I thought, wow, that's something that says a lot about a hospital. So as I went through the nursing program, I applied at the City of Hope, and I started here as a new grad. I was here on the Wing 1, which is surgical unit, and then I transferred to ICU. I was a charge nurse in ICU for about 11 years, and I currently am the charge nurse on the perioperative side, which is pre-op, pre-anesthesia, and phase 1, phase 2. So my journey has been an exciting one, being here as a new grad. Once I got here, there was nothing was gonna take me away from the City of Hope. I've had offers to go to different hospitals, but the camaraderie that you develop here, the community base, the employees that you're working with, everyone is just, they're so respectful, the integrity, the character. It just lives and breathes here at the City of Hope. And it's because of our patients and the patient population. It's just one of no other. And I haven't left because City of Hope does draw at you, and you're drawn in and you're taken in, and you just become a part of it. This is just a part of who you are and who you develop to be. So that's where I'm at.
Great. You mentioned phase 1 and phase 2. Can you elaborate a little bit more about what that's all about?
Sure. Phase 1 is PACU. So that's your intense recovery. So your patients that are having general anesthesia will come out postoperatively, and you're taking care of pediatric patients as well as the adults and everyone in between. So your skill level has to be optimal. You have to be fast reactor to any complications that can arise. Again, you're working with such incredible team of expertise surgeons as well as anesthesiologists and just the coworkers. If anybody's in a pinch, there's always somebody there to help. And the moment that you say, I need something, there's not one nurse there. There's an army of nurses there to help you and support you, which is pretty incredible.
Yeah.
So that's phase 1. Phase 2 is our patients that are going to be outpatient. They're going to be going home. So as a pre-op nurse, you have 5 seconds to develop a trust with these patients. And they have to believe that you're there completely for them and 100% going to go to bat for them for whatever the case may be. So in phase 2, the second phase before they actually go home, you're going over discharge instructions. Again, you have that 5 seconds to develop that relationship with the patients and their families, to make them feel so confident that when they're going home, all their answers have been met. All those questions have been met. All the answers have been given. And if there's any clarity that needs to be done, you're talking to the doctors, and they're there at the bedside to help the patients and to answer the questions for them as well. So that's just before discharge.
Great.
Mm-hmm.
You do a lot of educating of
A
the
lot of
patients.
education, yes.
For sure. How about you, Catherine? What's your journey at City of Hope then?
Well, hi, everybody. Thanks for joining. I came here to City of Hope about 14 years ago, and I started out as a PCA. But even before then, I had a calling to come to City of Hope. My mom had been a nurse here in the OR for about 30 years, and she retired after 35. I just really felt, she had always been happy here. And, coming to some of the family picnics and walking on campus several times, I just really felt a sense of just welcome. Felt like it was home. I just was so excited when I applied I started out as a PCA, so patient care assistant or clinical nurse assistant. And I just fell in love with the place really, truly when I first started my first job. And then after about a couple of years, I graduated nursing school, applied to be an RN on the hematology unit, and worked 10 years at the bedside, and then felt I needed to do a little bit more, or that I wanted to do a little bit more, and went back to school, and I am now the clinical nurse manager of our unit.
Great.
So
Very good. Very good. Part of what we wanted to also discuss today were some of the educational opportunities we have at City of Hope. One would be the new grad program. We have an ICU training program. We've recently started a perioperative training program. And as well as we started an experienced nurse program for nurses that have been nurses but do not have oncology experience. So we've highlighted some of those as what we'd like to discuss today. So what I'll do is I'll turn to some of our panelists. I'll have them describe what does it look like to be a new grad on their particular unit. I'll have Michelle talk about the perioperative training program as well as the ICU training program, what's involved in that. Leilani can talk a little bit about experienced nurses. So can I turn it over to each of you, and what does it look like to be a new grad? What does a new grad program entail here at City of Hope? And then some of the specialty areas. So
I think as an educator, I had my hands full with new grads. So the hematology and transplant unit are two of the larger units in City of Hope. And so we would have large cohorts at some times. And so it was great seeing, it's great working with new grads. It really, really is, because they're so excited. They're coming in with fresh eyes. We try and tell them it's going to be a steep learning curve, because it is. And unfortunately, a lot of the nursing schools don't have a lot of exposure to hematology, let alone transplant. And I think some of the schools are just trying to get into hospice palliative care. And that is also part of what we have to go through with new grads too. We have to talk about, we have a lot of success rate, but we also have, how do we make a good death? What part do you play in making this the best death that somebody may have? So as an educator, we followed the new grads for 14, 16, 18 weeks, depending. They went through didactic as well as clinical. They went to different units to get a different orientation as well. And then we followed them. As a manager, we're always having our fingers on the pulse of the new grads because they are our future. Our Clin 2s coming in with no onc experience are also, we're welcoming them. I have a few of them on my unit now, and they've just been a great delight because they have the experience. We just need to tweak it a little bit because we're dealing with this particular population right now. So that's been a wonderful opportunity. But I've dealt with tons of new grads, and Catherine has too, and they're still with us, which is encouraging for all of you who think like, oh, I could never do transplant. Oh, I can never do hematology, because you can, and we're there to support you, and we will be your safety net for as long as we can. And when you feel, you're ready to launch on your own, when you feel like you have those competencies checked off, because it is a steep learning curve, and this is not taught in nursing school. So you really have to, embrace it, have an open mind, be patient with yourself, and just communicate where you are, what you're feeling about, where you feel you are in your progress, and how we can help you.
When you look back on the new grads you've hired, what are the characteristics of the ones who have been extremely successful? I
think people who have like a je ne sais quoi, they have something about them that they come in, and the interviews are so nerve-wracking anyway. So we try and say, I have a big bag of candy on my desk. Do you need water? Just relax, take a deep breath. Let's get as many nerves out as we can. And then tell me about yourself. Tell me why City of Hope, and did you have any experience in oncology? Did you have any experience with hematology or transplant? Because then that lets me know, okay, you kind of have an understanding of the acuity of this patient population. Our patients are here for a long period of time. We have a long recovery process, but we have wonderful, awesome success rates. And it's due in part because of the nursing care that happens. So we have fabulous nurses at City of Hope, and it's part of that training. I think when new grads come in, they have these portfolios, which is great because then you can look through it and ask questions. But I want to know what's not on this piece of paper here. Tell me what's on, tell me about yourself that I won't find on this piece of paper. And, sometimes you get, well, I started TAP at age 5. So sometimes you get that, which is fine, but there's an engagement, there's questions, there's curiosity, there's, at the end, I'm like, ask me some questions. What do you want to know? What didn't I cover? Did you get what you wanted out of this interview? And give people an opportunity to ask me the questions. And if I can't answer them, I'll get you the answers. But a lot of that interaction really helps because we have a short period of time to evaluate, and I've got 1,000 questions running through my head. Who are you going to eat lunch with? Who's going to be your support system? How do I think you're going to do in this transition? How do I think these clinical skills are going to work with your educational background? So I'm already thinking and putting those things in. So the more I can get from you during that 30 or 45 minutes, it helps me get a really good impression of you.
And on the new grad program, can you describe like how many weeks it is? What's the didactics on it? Can you just describe what the program looks like?
So usually it's anywhere from like 14 to 18 weeks. And what happens is because you're starting out fresh, and we know schools don't include this information. We start with cancer basics, basically. So you're going back to school every Monday, you're in the classroom, and we're going over different parts of oncology for you because you're a part of a group that is going to be disseminated on various floors, whether it's med surg, med onc, hematology, transplant, or you're starting somewhere. So we have to provide everybody with the same foundation. So you do a little bit of didactic, and then we put you on the floor with your preceptor. And then the educators are very closely involved because we need to know, are you getting the experiences you need? What do you feel like you need more help on? We do blood products like nobody's business here, chemo, blood products, transplants, pain meds. We need to make sure that those core things that we do every single day, you know what you're doing, you feel comfortable, you know your resources. So that's how we do it. And then as things taper off, if you're transitioning to nights, we send you on to nights. We're still following you, but now you got to learn a whole new little system there, because you have that, but now your busy times are different and your flow is different and the demands are different. So that's a whole new learning process. And we know that. We think you might be at step 10 on days, but when you transition tonight, you've taken 3 steps back, which is fine. It's a whole new learning curve. And then you're getting back up before you're released on your own. We have the preceptors stay with them so that they're following the same schedule. So that's like a safety net. The charge nurses there are, I can't say enough about the support that you have when you're on your own, and everybody's there to help you because we've all been there before. Our patients are our first priority. So that's what their focus is. So once you're hitting about 14 weeks, we're gonna say, okay, let's see, is your checklist done? Are you competent in these areas? Are we ready to launch? And then we might say, no, I need, new girls, I just need 1 more week. Okay, well, let's see, what are we going to accomplish in that one last week? Have you given platelets? Have you given FFP blood? Have you done those things? And we try and do those too. Do you know your resources? So it is, it's a very tumultuous journey. And it usually takes about week 10 that things just kind of click. And we wait for that. We know that you need to be patient from weeks 1 through 9. But at week 10, something happens and all that stuff that you've been doing starts to settle in. And that muscle memory of getting all those antibiotics and the drugs and the lines, you've got that down. And now things can start to make more sense. And we see the light bulb go off. And that's when we're like, okay, now let's ramp it up a little bit.
I understand that there's also homework between the day that you're in the classroom setting to the next one, that some new grads have mentioned that they're given an assignment to complete this and then present it the following week.
Sometimes we'll do that too. We learn from each group and we learn what's worked and what hasn't. And each group has different needs. And some groups are really communicative and they let us know like, hey, what about this? And what about that? Like, great question. Let's talk about that. And as we said, you're just coming out of school. You don't know hematology. There are all sorts of heme malignancies, different types of transplants, all the different type of leukemias you can have. So you might be asked to do some homework on your patient. You might be asked to do, well, okay, you take lymphoma, you take leukemia, you take amyloidosis, you take all of these, and let's present so everybody learns. Or you might get a drug. We give a variety of antifungals, antivirals. So, okay, there's 6 to choose from. Let's learn all about them. Or, there's just a variety of stuff. So we do send them home with homework sometimes. Yeah. And it's a great learning thing. That's awful, a learning experience for them. And it's also good for us because it says, what are you getting out of it? What are you able to teach back to your group? How much are you comprehending? Because there's so many tasks and the day can be so fast paced that we really want you to have a good, solid foundation.
What about clinical trials? How does that play out on your floor when you have, maybe Catherine can,
well, our mission is to, transform the future of healthcare. I mean, we've been doing that for 100 years. That's what we're made for. So, particularly on 5th floor, we do a lot of phase 1 and 2 drug studies, and we have a lot of first in human, medications that are being given. So it's quite exciting. Never stop learning. And I think it's one of the reasons that some of the nurses choose hematology as opposed to other units. Mm-hmm. We learn throughout our whole organization, but excitement, giving medication first time to a human being, that's amazing.
Yeah, that's fascinating. So, that was one of the things that surprised me most when I first came in here. It was the research. I thought I was coming to work for a hospital. And when I was like, boy, it's anything but a hospital. That's an awesome component, but the research that goes on here has
Yeah,
just
it's-
totally
it's
blown
fascinating.
me away. I've just been
But
so
this is,
impressed.
it's nice to see that you can take it from the bench to the bed. Like
Yes.
you're the one that's doing it. You're the one that's contributing and you may not realize it, but most of the patients in the hospital are on a study of some kind. And so you are constantly doing research and learning, and sometimes they're longitudinal studies. And so you might not see the benefits or the end result of that for quite some time. But everyone contributes to that research.
And what's so exciting as being part of a bedside nurse is sometimes, like, well, for example, we'll have Dr. Portnow and some of the people from her team come by and do a lot of one-on-one education for the nurses, for the patients, to talk about the clinical trial that they're doing and what to expect, and, you know, really give you the support that you need as a nurse. And they won't just come once, you know, they'll come every day, multiple times throughout the day, just to make sure everything is going the way as planned, and to keep in constant communication. Always say, here's my pager, call me whenever you have a question, or whatever the case may be. There's always a connection with our docs. It's really amazing. Again, that goes back to what drew me here was the camaraderie and the connectivity that we have with everyone on every different level. From, I mean, just any different level, you can see the mutual respect. And I thought that was just, for me, that was a big draw. And I think that's why a lot of nurses stayed here for so long. And still, I'm here and it's 17 years. I'm still a newbie compared to some of the nurses that have been here for, 20 plus years, which is nice. It's nice.
There's a lot of nurses that would give a tour to and talk about the clinical trials that they would participate in. And they said that's so unique that that's not something that they would do at a community-based hospital, that City of Hope is so renowned for the research that we do and makes nursing so exciting to be part of that next, latest, and greatest cancer treatment.
You're always learning.
Oh,
You can't let the dust grow under your feet. There's something new, and then they're finding this, and then we'll try this, and let's try it with this group. And so there's always an opportunity.
that's phenomenal. Michelle, would you like to talk to us about we do an ICU training program in which you participated in, and also the perioperative training program that we just started offering. We highlight those two training programs.
Well, as I said, I was a new grad here. So starting as a new grad, we were the second class at the City Hope for so long. So our group was a large group, and it was, we had a ton of support, and the transition from new grad into the nursing role, as Monica said, we had a huge amount of support. A lot of foundation was supported. Every day there was something that we were learning new, and we did have homework. We had to learn about diagnosis, about treatment, about surgical interventions versus radiation treatment. There was a whole gamut. And, of course, you're not going to learn it all in one sitting.
Right.
So it is a process, and it does take a long time. But the transition with the new grad program was an excellent start for us. And majority of the nurses that started as a new grad are still here at the City of Hope 17 years ago.
Wow.
So, but transitioning into the ICU, and, being that I had been a floor nurse for 5 years, I decided with one of my other coworkers, let's go for it. Let's take that plunge and go into ICU. We thought, oh, here we go. It's the cream of the crop. You get everything in ICU. It's intense. There's just so much to learn. And at first you think that's just too much. It's going to be really overwhelming. But again, the welcome that we had, the support that we had from the nurses, from management, from our educators, just made sure that everything was in line. We had the support that we needed. We went through several months of training. First, we started with the in-class critical care and the EKG, just the basics. And being that I was a nurse there already, I kind of had the upper edge on some of the other nurses because some of them had no experience, some of them were new grads, some had not been in the oncology area at all. So it was nice because they can bounce things off of me and vice versa. So they took us through a program for several months, and then we transitioned to bedside care. When the transition did occur, my preceptor was always there. She was always at my side. I was on her shifts. We were doing days. So if there was ever a problem and I felt like, oh my gosh, I'm not going to ask this question, but I need to know, I'd go to my preceptor. That's who was there. That was my go-to person. And again, after going through the program, I became a preceptor after several years, and you make the same connection. You give the same support. You're there. Your orientee is with you, and they're sharing your schedule. So they're right next to you. You're budding up. So you never feel that you're ever thrown into a circumstance that is not something that you can do. Safety is our number one priority. Our patients are our number one priority, and that's always at the forefront. And I think whoever comes into a position at the City of Hope, they'll find that it would be so hard to go anywhere else because it is just something you would be a part of, and you get the support that you need. And I don't know if every hospital is built that way. All I know is that being here after several years, I wasn't going to go anywhere else.
Right.
So, as far as the peri-op program, I know a little bit about it. I know that they just hired a group of individuals, about 6 individuals. They're working with Peter.
Right.
Peter Hirsch is our educator in peri-op. The group it's kind of fun to watch them go through the OR and go through peri-op. They kind of travel in packs. So it's like, oh my gosh, I remember being there. So it's exciting to see them, to see their faces, and they ask questions. And for the most part, they're just, they're seeing how the operation works. So not so much specifically, okay, here's OR, you're doing a laminectomy, this is what you need. It's more of, okay, here's the big picture. Here's City of Hope, this is how we run. This is how our hospital is. These are the people that make the City of Hope. And then I'm sure that they're going to go into more details into the program. But right now, I think they're just traveling around the units and getting a feel for what is to be expected. And then I'm sure they're doing some classroom support as well.
Right. Very good.
Yep.
Catherine, on your floor, you can highlight what it looks like to be a new grad. What you look for in new grads is also the experienced nurse training program, how that's going for the ones that you hire.
Well, I love interviews. I love seeing some of our new grads. They come in, they're so excited to learn. It's just kind of like a breath of fresh air to have them come in. And what I look for, I ask them questions. I want to know that they want to work in a team. Sometimes you get people that are just, I'm focusing on my one thing. I don't really have time for anybody else. I just got to stay focused. But you can't work like that. You can't be successful like that. You have to reach out. You have to ask questions. And I love it when we get those people for interviews and they have so many questions. I love it. So a new grad on my unit, they go through the same training program that Monica had just described. They're coupled with a very knowledgeable preceptor. We usually have a lot of our charge nurses and nurses that have been on our unit for a long time train the new grads. And I feel that they provide great support. I rarely have someone come in and say, this isn't working out. I don't know what to do. I'm not getting it. I really feel we take the time to work with them, address their individual needs. It's really a supportive program.
I think Catherine and I are fortunate enough that we, not only being sister units with a similar population, but our seasoned staff kind of grew up together, so they're very, very similar. And then when we do our making sure the experiences are coming in, we can say, I don't have any chemo this week, and these are the days are here. Do you have any chemo that I can have them do? Or do you have this? So we work with each other to make sure we can get those.
Yeah, there isn't one skill or area on the checklist that is not checked off when a person goes off on their own. They've, done everything on there. They've experienced multitude of experiences, and I really feel that they feel, confident and I can do this, not a problem. And our charge nurses, they really monitor their assignments, make sure that they're fair. They care about them and want to make sure that, they're not going to feel, whoa, what did I get myself into? That rarely happens. I can't even remember a time that it did happen, and I've been on the unit for 14 years.
That's great.
So.
Bet you, Leilani, I know we just recently started an experienced nurse training program, so you can kind of address, what does that look like? How many weeks is it? What do you look for in an experienced nurse?
Well, for the experienced RN training program, we started it last November. So we hired 5 nurses that have a BSN or MSN, and they've had 1 or more years of acute care experience in a different specialty. And with this program, we're training them in either bone marrow transplant, hematology, medical oncology, or surgical oncology. Of course, they would have to pass through our bone screening process. And then if they pass that, then we have them interview with either Catherine or Monica or the other units. And then they go through a 14-week didactic classroom training. They are with a preceptor. They do get the support. And I think for this August 24th, which is next month, we hired 14 experienced RNs. And the word's getting out there. And sometimes the nurses that we've hired, they wanted a position as a new grad in either oncology, BMT, hematology, or medical or surgical oncology, but there wasn't anything available. And they've heard of City of Hope, so they didn't have a chance to go ahead and train in that. So they either went to ICU or the ER or the DOU, med-surg as well. And when I do get calls about it, it's like, you're going to train me, who's been a nurse for 5 years in ICU, into oncology. And this is something I've been wanting to do, and City Hope is where I wanted to be. And I would say yes. And they're just, oh my gosh, this is great that you have this program. And we're the only ones that have this program. So we're pretty proud, and they've been very successful. And we're really excited about this group that's starting on August 24th. And hopefully every year we'll probably up the numbers to 12 or more. So that way we have experienced nurses on our units.
Excellent, thank you. Something else that we have is foundation community practices that we hire registered nurses into. We have Antelope Valley, we have North Count Valley, we also have South Pasadena, Rancho Cucamonga, Corona, West Covina. We have our community practices in those areas that we're hiring registered nurses to, and your training would be more individualized there within the community practice that you were hired into. But just want to make sure we highlighted that also as one of the opportunities within City of Hope. Anything else that any of you would like to add regarding what it's like to be a nurse at City of Hope, or experiences that you wanted to share? And I know being a nurse at City of Hope, one of the things that we pre-screen for is not just taking care of the patient, but taking care of the family, because the family is such an active part of the treatment for the patient. And how do you prepare your nurses for dealing with death and dying, as well as dealing with caring for the family? Yeah, what do you do to help your nurses be able to come alongside a family?
Well, it's definitely, the family is part of the patient, and our patients have an extended length of stay from what the community might be used to. So you really get to know the patients, and you know their families, and you know their caregivers. So when treatment fails, or when we're transitioning to that next step, you have to really focus on what are the patient's wishes, and then let's get the family comfortable. You know, there's a lot of education going on. There's a lot of support. There's a lot of reaching out to social services. There's to support the staff. How are you doing? You know, how's your patient today? How's the family? We've had a couple crises on the unit where we might have had some incidences happen where we've had multiple deaths in a short period of time. And that's when we bring in, do we need to have like a tea time for the soul, which is what we call it. And so we set up a tea, and that's, you know, dimmed lights, and the staff can just come in. We can talk about things. We can not talk about things, where they can just recharge their batteries. And just, we know that death is a part of life, but oftentimes it's not a welcome part, and it's not an easy part. So we understand that. And even in part of the interview process, I think Catherine will say it too. How do you recharge your batteries? How do you deal with death and dying? Do you have any experiences with X, Y, or Z? What do you do to make sure you're not going to get burned out? What do you do? Do you run? Do you write? Do you cook? What are your hobbies? So that we know that we can help you a lot, but you also have to take care of yourself. It's very important that you have self-care as well.
Very good.
And sometimes as a charge nurse, if you have a patient that is actively dying, and you know, as a charge nurse, if you can make the adjustment with your assignment, the nurse will have maybe just that patient to see and to take care of, and to be able to be there for the patient and the family, and to provide the support that they need. So that sometimes is an option if we're able to do it. And we try as best we can when we know that something like this is occurring, to allow the nurse to have that time, so they don't feel that they're being pulled to several different rooms when they really just want to be in this one room with a family as the patient, has their last hours maybe. But there is a lot of support. I've been a part of the Tea Time for Your Soul, and it's just always been a welcome as a bedside nurse, because it does help you recharge your battery. Because sometimes even if you don't say anything, you're just sitting there with other nurses, you can just feel sometimes the sense of anxiety and sometimes doom.
Yeah.
And then someone would spark a conversation and say, do you remember our patient over there? And then, oh yeah, do you remember so-and-so? They remembered our name and they said, thank you. And, it allows for a conversation, and that's definitely part of the healing. But our patient population is just one of those populations that is just amazing to care for. So we're very fortunate to be a part of their lives, and fortunate to be a part of that other part when they're dying. Yeah.
Anything with your nurses that you do special?
Well, we just had an experience recently, but what I loved was that the support's always there. And I love that staff, feel that they can reach out, stop you in what you're doing and say, hey, I noticed this new grad's having a difficult time. I'm on the east side and she's on the west. Can you pop in and check on her and make sure she's okay? And, I love being able to do that. Sometimes it's just being there, so, helping her figure out the paperwork, or, taking her pager so that she could, stay with the family. And I just love being able to do that. And I feel that in the 14 years that I've been there, there's always somebody. You're never alone. You have your colleagues, you have the charge nurse, the managers. We now have assistant managers. It's wonderful.
And on certain units, they had started grieving rounds, because sometimes with the terminal extubations, you can hold so much in, and then after a while you need an outlet. And so I know ICU is working with grieving rounds, and that was very beneficial to the staff there. So there are multiple venues to take part in, to express your own grief, express your own fears, express your own comfort level, whether it's good or bad, with the situation.
When you say grieving rounds, what does that look like on your unit?
I'm going to actually turf that to Michelle, since she was an ICU.
Generally, what that means is that we're discussing certain topics, patients and their families, and then of course we're expressing how we feel about it and how we've dealt with it. There's a whole group of individuals that are a part of it, and the nurses don't feel that they're alone, and they feel like they've got the support that they need. So that's just part of the grieving rounds, is that we go around and we discuss patients and where they're at in their either they're progressing forward or not, and what we're doing to bring the family together for closure, and also the support for the nurses. So.
Lavelle,
Yes.
We have a couple of questions.
Oh, sure.
From the
Okay.
audience.
Great. I have 2 questions here. And the first one is, how many nursing openings do you have at the moment? And I think we would say it's about 144 would be about right.
I'd say 150.
150, okay. Leilani has the latest and greatest. So we currently have 150 openings in a variety of places within City of Hope, and that would be registered nurse positions. And that includes our community clinics that we have, as well as inpatient, and we have outpatient on the main campus at City of Hope too. There's a parallel for every inpatient to the outpatient. So for ICU, we would have the Evaluation Treatment Center as a parallel. For medical oncology, we have the same outpatient, as well as hematology. BMT would also have a parallel setting, as well as pediatrics. There's inpatient and outpatient. Did I forget any of the others? Surgical services. We have medical, surgical, and we have then the outpatient surgery center. So that comprises of those 150 openings that we currently have.
So refer anyone that you know.
Yes. Great question. And the next question is, what are your biggest job motivators? Is it patient care or certain responsibilities? I'll let you guys answer that. What motivates you guys?
I think from a transplant perspective, is every year we have the transplant reunion, and every year there are more people at that reunion, and every year you see the button. So each person, each survivor gets a button and it says how many years they are a survivor. And those numbers increase every single year. So when you are supposed to tell them, you have to go to the reunion, because you might feel that you think about it, in the hospital, you're really seeing the sick of the sick, because there's outpatient. So really the people who are in the hospital are really sick. And what we do to them in terms of chemo and immunosuppressants and the drugs that we give, you really can have a sense of, am I doing the right thing? Am I making a difference? And I said, hold that thought and go to the reunion, because you're going to see your patients with hair, with regular clothes on, with their families. So it's a totally new, a new perspective that you're taking on, that you have helped the patients get here. You have helped in those outcomes that we have, that you have been a part of the research that has been going on. You are a part of everything. When we look at our outcomes and we look at the journeys our patients have taken, the nurse is there, and she's a huge part of where this patient is on their journey. So that, from a transplant perspective, I would say you have no idea the impact that you have and what you do every day. No idea.
That's great.
I agree. It's the patients that will keep me here as well. The patient population, the experience that you have, and being a part, and just the one thing that you take for granted when we go to work. We go and we do our job, and we're excited about it because we can get up every morning and do this. As patients, their job is their hope for the day. Maybe their white cell count to come up. Maybe their hemoglobin's too low. Maybe it's as simple as, I really want to take a walk outside. And your goal as a nurse is no longer work and I'm going to do this and that. It's like, wait a second. Hold on. What's your goal today? It's to go outside. We're going to do that. This is our time slot, in between a transfusion or your physical therapy. Let's make sure that we get your IV pole disconnected and you're outside. So I think that with my job is always going to be there. It's how far do you take it? And with shared governance being part of our goal as well, we take it a step further. Not only our patient population, it's how do we support our nurses in policy and practices and clinical endeavors and things that are coming up. So it's hugely patient, but it's also coupled with those responsibilities that go hand in hand. And you as a nurse have to see it for what it is, to take it and own it.
I think that's the big thing, is the owning it, because we're living with a transitioning healthcare system right now, and we have a dynamic field, and you have these complex demands on nursing, and with everything transitioning the way it is, the nurse has to be there and be like, do I have enough information? Am I, that burning has to be a burning spark is too much. It's not. You will never have enough education. You will never end learning something new and educating yourself. So the demand as a nurse.
And City Hope really provides you with that support. Absolutely.
Any comments you have about what motivates you, Catherine?
Well, I was just reading about how in the time that we've been doing transplants, we've added 30,000 years of life.
Wow.
To, for patients. And that in itself is amazing. And I feel like, I can see I'm part of that. And I'm so proud to be part of that.
That's awesome. Absolutely.
We have a few more questions.
Oh, wow. Great question.
Thank you.
Thank you very much for asking questions. The next one is, what do you do if a patient refuses care at the risk of his or her own safety?
Well, that is a good question. First of all, if you're coming to City of Hope, you're coming with the intent of cure. That's what we're going to shoot for. And we need the participant, that patient, to be a partner with us. So that it really is going to be a barrier if they're not on the same page as the team is. There are certain times when the treatment gets a little rough and patients might say, I don't know if I can do it. We say, hang on, this is where we're going in the trajectory. This is what day you are. This is where you are now. Let's give it this amount of time. Let's address this again. We're not leaving you hanging here. Let's see. If it's truly something where we're at odds with the treatment we're doing, then we really have to get into, have family conferences, have ethics committee. I mean, we really all have to be on the same page, because our goal is to help you and your family.
Right.
And make the best decision possible. And I think with all the different groups that we have available here, social services, our ethics committee, our doctors, everybody's so readily available when something does happen. And it has happened where patients come in and they're about to have surgery and they're just like, no, I can't do this. I can't do this. And they're really upset and their emotions are really heightened. We'll bring in social services. We'll sit with the patient, we'll bring the doctors in. Everybody will come in and talk with the patient and see where was that bridge that kind of broke off a little bit that we need to support again? Because obviously they were here for a reason initially. What happened during that transition between, yes, I'm going to do this, to I'm scared? And if it's really just being afraid, why can't we bridge that and take care of our patients and give them the support that they need? So there's a lot of communication, a lot of time. And that's one thing that I noticed too, being here at the City of Hope, is you have time to sit with your patients. You can actually sit down and not say anything and just sit there with your patient and discuss whatever it is. If it's a game that they've been wanting to see, a golf tournament, it's like, well, let's look through the book and see what channel this is on. So things like that you can support your patients. But patients always have an option. They always have an option to go forward or to refuse. And we completely support our patients, and we provide them with enough information so they can make an educated decision.
For the most part, I think our patients want to move forward, and we're there to support them, and we're their cheerleaders, especially on the days when they're not feeling like they can do it. And for our patients that are here for months at a time, there's going to be plenty of days where they're like, I don't know if I can handle this. And we're right there to say, yes, you can. And we're here to do it with you.
Yep. Let's get you out to group. Let's have you out to the, the lobby. Let's get the pets in for pet therapy. And what could we do? What's the most important thing today that we can do? What, tell us. If we've got, with child life services, we have social work, we have the nursing staff. So,
and they tell us, and we write it down for them.
Okay.
We have a board that sits in front of their bed that they can look at every day that says, this is who I am, and this is what my goal is. This is what I want to accomplish today. So we have it there, and the patients can look at it, families can look at it, doctors, everyone looks at it, and they can add their notes, words of encouragement, whatever it may be, to help our patients. It's there.
Do you ever parallel or partner patients that's struggling with someone that has overcome that or past that part of treatment? Do you ever do that?
We actually have a lot of family members or spouses of patients or patients themselves who are volunteers.
Okay.
We actually have employees who are survivors. So if we know that there's a certain patient that's having a rough time with this particular, let's say a transplant, I pick up the phone and say, hey, do you have time to come and see somebody? I think it would really cheer them up. And I talk to the patient, I'm like, are you okay if I send somebody? And a lot of patients know, because when it is that reunion time, they look out their window or they look on the TV and they see who's there. And so when they say, oh, you mean he'll come and see me? I'm like, yeah, you better believe it. Yeah. So we do that. But we have a large volunteer network also of former patients.
Perfect. That's great. More questions. So thank you. Very good. Okay. The next question is, as a student, what advice would you give, and what educational steps would I take in order to be a qualified and experienced nurse at City of Hope?
Okay, the first step I think is to decide I want to be a nurse.
Once you decide, cancer nurse.
I want to be a oncology nurse. That's right. Go City of Hope. But you want to be an oncology nurse. And once you've decided that, I think that's your biggest step. Because once you decide to go forward, you just trudge on through. I started as an associate degree nurse, and I went back to school and earned my bachelor's with Sigma Theta Tau. So I was able to do really well. But I started as an ADN. I would suggest go big, go for the bachelor's, start with the bachelor's. But if you cannot, and you want to start with an associate, go right ahead. But also know that you want to continue your education and go for the advanced degree as a BSN. I would also recommend becoming a PCA, which is a patient care attendant, working at the hospital in that way, or even as in any area in a hospital. It doesn't necessarily have to be nursing, just so you can get a perspective on how a hospital runs.
Right.
Even volunteer as a nursing student. I would suggest doing all of those items first to get your feet wet, make sure this is really what you want to do, and then go full force and believe that you can do it. And each day, always go towards that goal and accomplish it.
I think you really have to be honest with yourself. Cancer nursing is not for everybody.
That's right.
And I think that's the beauty of nursing. And you can, a variety of different types of nursing, but you have to make sure, and you're the only one who can answer this. You have to love oncology nursing. You have to have that calling. You have to be passionate about it. So one of our values is compassion. But I'll tell you, you have to be passionate about the work you do, because your patients everything is anchored in patient care. So you really have to be their cheerleader, and you have to be their advocate, and you have to be a colleague amongst your group. So you're part of the support net. So you really have to want to do it. You can't just come here because you need a job, because you'll be disappointed. And as I said, I was fortunate enough. I started as a student nurse extern in the Midwest, and I didn't know much about transplant. It was the only place that had a job, but I started there, and I'm like, I found my place, and just went up from there. So I think starting as a student is a great idea. Starting as a PCA to get your feet wet is great too. But that passion, that has to come through. We can teach you the skill. We can teach you how to do that, but you have to have drive. You have to have compassion. You have to have a passion and lifelong learning, because it's not ending.
Something that I would add as a student, the advice that I would give is to do an oncology preceptorship of about 120 hours in addition to your oncology rotation, because that's one of the things we look for, is that acute care setting that you have done an oncology rotation, hematology, cell transplant, that you have that experience with patients that we would be taking care of, because I think it's so valuable that you have an awareness of what the patient population is, and possibly get the preceptorship through your school at City of Hope would be one of my recommendations, because we do look for that on the resumes for the student nurses that we're hiring, is number one, an oncology preceptorship, and number two, definitely an oncology rotation, so that you're aware of what it's like to take care of oncology patients. I do see a lot of new grads that perhaps all of their experience had been in maybe labor and delivery, women's and children's services, in ICU, and we don't have those at City of Hope. So if you're really
Come to City of Hope. You want L&D.
Yeah, you want labor and delivery. So just making sure that you are really showing as a student what your true interest is, and you really find what your passion is as a nurse. Because I do think, as Monica was saying, nursing is very diverse, and you're going to be called to a certain area of nursing. Certain kind of patients will really, at the end of your clinical rotation, and say, I love taking care of that kind of a patient, whether it's labor and delivery, ER, ICU, medical oncology, medical surgical, pediatrics, is such a variety, but you will find that that is the patient population that you really love. And so to us, that's what we're looking for, is people, especially student nurses, that really have a passion for oncology, and they couldn't imagine taking care of any other type of patient. I think that's what we've been looking for. Our new grad program has been very successful, because that's what we look for, is just that real passion for taking care of the types of patients and coming alongside of a family, because that's what's important in oncology nursing, not just take care of the patient, but the whole person. And our motto is, there's no profit in curing the body if in the process we destroy the soul. And so that's what we're looking for, is nurses that can do that take care of the whole patient, the whole soul, the whole family. And so that's,
I think another thing that's good is that there's so many opportunities. And I think we're great examples of, we've been in multiple positions, multiple places within City of Hope. And, there are a lot of people who are, hey, I want to give day hospital a try, or I want to give the clinics a try. Totally different pace, same patient population, but different pace. Hey, I want to give research. Like, what would it be if I was like a research coordinator or a nurse coordinator? So there are so many opportunities that I think it's nice to start out somewhere, but the door is open.
Be amazed.
Very, very true.
Yes, it's
Amazing.
amazing.
Now, the next question is, what is the best and worst part of being an oncology nurse? Well, there's some
Wow.
good questions at you guys.
Good questions.
Very good questions.
I think the best part's going to that reunion, seeing
Okay.
the lives that you've helped to save. And then the worst part, I don't think that there is any worst part about being an oncology nurse. I think my experience at the bedside and even now with my own nursing team, it's just, I really feel that there's more meaning to my life.
Okay.
And, just in an instance, you could be sitting in that same bed with cancer.
Yes.
And it's just an everyday reminder to value, where you're at, what you're doing, and your family and who you're, that time with your family and loved ones.
Even some of the people here in HR will say that they're gonna be having a really bad day and they'll walk onto campus and realize I have so much to be thankful for.
Oh, sure, yeah.
You'll see patients in a variety and it's like, wow, kind of going back to, it just makes you so thankful.
At any age,
Yes,
it
yes.
could happen to you,
That's right.
happen to anybody.
Any other comments from you guys, best and worst part of being an
I think there are
oncologist?
always lessons to be learned. I think even if you have a bad day, you've learned something. You've learned something about the situation, or you've learned something about yourself. You've learned where your strengths are, and you've learned where, hey, maybe I need to look at this a little bit more, or look at it differently. I agree with Catherine. I don't think there are bad parts of it. There's so much to gain from oncology nursing, and just using the patients as your inspiration. I don't think there is a bad part.
Okay.
And I'm going to have to concur with both of them.
Okay.
It puts everything into perspective,
Yeah.
your own values and what you deem important in your life. The patients, it's just an honor to be a part of their lives,
Right.
and to serve them in this capacity is just amazing to me. And I value just coming to work and being able to be a part of someone's life in that magnitude. And yeah, you're right. There's no real bad day. The
Right.
bad day, I mean, if you can learn something from your day,
Is it
then
really bad?
it really
Yeah,
wasn't
learn,
bad.
so-
It really
That's
wasn't bad. It's like, okay, wait a second. We did it. We did
Yeah.
it. We came together and we took care of business. So
Right.
yeah, I'd have to say that it's always a learning experience.
Great.
Mhm.
I want to thank you guys. You're amazing panelists, Monica, Michelle, and Catherine, and
Thank you.
Leilani. Thank you guys so much. It's been a very interesting conversation and panel discussions. I want to thank you guys for participating. And then our live discussions are consistently going to take place on the fourth Tuesday of every month. Our next one will be on August the 25th. And it's going to be an interesting topic about cultural sensitivity in patient care. And if you missed the original session, you can always see the recordings on YouTube. Just go into hashtag Nurses for Hope and you can view them. And then also check out our jobs, of course, at City of Hope. Just want to thank you for watching, and again, look at our job postings here at City of Hope. Thank you.